Guys, welcome back to Medical Coding with Blue. Today's episode is all about medical coding job listings explained. And do you have to know ICD-9 in 2023? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So first I'm going to start out with, do you have to know ICD-9 in 2023? No, you do not. When you see that in a job listing, it is basically an error. So a lot of times the health information department will put in a call to their HR department and they'll say, hey, we need medical coders. The HR department says, sure, no problem. We will just pull the template that we have looking for a medical coder and we will list it on our job bank or, this job search site. Never updating the job listing. And sometimes they don't know like all the ins and outs of what we do because they're HR. Their main focus is the employees, not the little nuances of every single department. So when you see ICD-10 / ICD-9, that just means that they just added that on there. Okay, because maybe the person in the HIM department said, hey, just make sure they know ICD-10. And so then they say, okay, well, I'm sure they have to have known ICD-9, so let's go ahead and just add ICD-10 to it too. So that's the reason that those come out that way. So if you see that, do not panic. We don't need to know ICD-9. No one uses ICD-9 anymore for statistical or billing purposes at all, ever, because there hasn't been an update to ICD-9 since 2014, okay? And because in 2015, on October 1st, 2015, the ICD-10 CM and ICD-10 PCS codes went live. And no one went back to ICD-9. Everybody moved on, okay? The other half of the world is already in ICD-11, okay? We won't be in ICD-11 until some years from now. So don't even panic about that. People are already panicking about it. It's nothing to panic about. We don't have a definitive date yet. And again, we are quite a bit of ways in time away from that. But if you learn ICD-10, you can certainly learn ICD-11 when it is time. But that, again, that won't be for quite some time. So if you see that, ignore it. Just go ahead and apply anyway. The other thing that you'll see is that they are asking for 3 to 5 years of experience, a year of experience. Candidate must be experienced in medical coding. Must have. Yes, we all know. Every employer wants to have an experienced medical coder. But if you are in an area where there are happy coders, and happy coders are going to stay where they are, okay? It's if they have some other issue, maybe, a company consolidation or something like that, and they got laid off or whatever, and then you'll have people who have experience that are looking. But for the most part, if happy coders are in the area, they will stay where they are. Now, that is an opportunity for you as a brand new medical coder to go ahead and throw your hat into the ring. If you don't apply, they will not know who you are. Some employers will be like, okay, look, we haven't had any experienced coders applying, so we're backed into a corner. We need people. So let's look at these new people who are brave enough to apply. Oh, this person was brave enough to apply. Let's go ahead and give them an assessment test. But I bet you they're going to fail it. That's what they're going to think, right? I'm just saying that they may say that, oh, well, I bet you they'll go ahead and fail it. Well, when they give you the test and you go and you pass it, then you're going to be part of that group of coders that is going to be changing hearts and minds when it comes to new people. So be part of a positive change, not be part of that reinforcement chorus of, you see, I told you, these new people, they don't know how to code. Well, because they didn't learn in the school. Okay, so you cannot expect an employer to train you. Because even for me, when I got here to my forever home, it wasn't even a year that I was coding yet. Not even a year. And that was the first thing my boss told me and the other new people that got hired. This is not a training ground. If you got hired, that means you have the competency. You have to be able to maintain your knowledge now. If you don't, or if you start to struggle and you don't ask for help, or you don't make efforts to help yourself, we have no problem letting you go. And it's as simple as that. This is a very strict field in the fact that there's not going to be a lot of hand holding. And the reason that there's not a lot of hand holding amongst the veteran coders with the new people is because there was a lot of veteran coders who came up where they were training themselves and they didn't have anybody else to show them, so they're not going to show you because that's how they learned. Not all of us veteran coders are from this mindset. I do not have this mindset. However, I have had new people take advantage or try to take advantage of me because they will come to me and say, well, Blue, I'm lost, I need help. And this is a very simple procedure that I've already explained to them how to code, and they still want me to code it instead of them code it. So I'll go through it with them the first time. But when they keep coming back to me and saying, well, can you do this one? Can you do this one? Then you're basically having me do your work and you're getting paid the same thing. Well, not the same thing because, as a veteran, I'm going to get paid more. But you're getting paid what a brand new coder is going to make anyway, which is very good. All right. And so, no, I'm not going to do your job for you. That's not fair. But there's people like that feel entitled to that. Like, well, no one trained me. Okay, so then you can't pick up a book and learn on your own? I'm just saying, that's what we do. And that's a part of our responsibility. Now, if you said to me, hey, Blue, I tried to do this one. These were the codes that I came up with, but this still isn't right. That's when I can see that you tried to do your own research. So there's a difference there in somebody who does that. So be part of a positive outlook on these new people. Okay, if you are new yourself, you want to set the example, because that's the way I tell my providers when they see me. I say, I want you to have a positive experience with coders, so that when you go out and you go on to another facility, that you are going to expect the same level of service, the same level of commitment to the industry that I have. You're going to expect that from the other coders that you are coming in contact with. Because there's a lot of like, well, no, I'm the provider, I'm going to tell them what to do. No, that's not the way that this is. This is a team sport. Okay, there's no I in team. This is a team sport with providers and coders. But the coders also have to bring their A game because they have to be able to get on board with what these doctors are saying. So I want you all to think about that. You have the power to train yourself, to learn more, to do the practice. No one will do this for you. You cannot buy this knowledge. You can only earn the knowledge. So I'm going to leave it right there. But I want y'all to know that y'all can totally do that. It is within your power to do that. And it is also within your power to apply, because it is free to apply to all of these jobs, even though they're asking for experience. But what do you bring to them? You got to make sure that you're bringing a stellar resume that is one page. One page, and it goes back 10 years, no more than 15 years. Because no one needs to know that you worked in the 90s or even in the 80s. No one needs to know that. Because none of those skills are relevant today, all these years later, 40, 30 years later. It's not relevant, all right? What's relevant is the last 10 to 15 years, because when they run a background check, that's as far back as they're going to run, 10 to 15 years. If they need more, they can ask you for it. But this is a quick snapshot of you. And no one wants to see on your skills that you're organized and you're a team player. If I see that, I'm immediately rejecting that resume, because you're not telling me what your hard skills are, which is ICD-10-CM, CPT, HCPCS, all of those, everything that they're asking for in those job listings. I'm just saying. So one of the other things that you may see in these job listings is they're looking for professional fee or pro fee coder, right? P-R-O-F-E-E, P-R-O-F-E-E, pro fee, professional fee. This means outpatient coding. The best example for this is when a patient is admitted to the hospital and the hospital has to call in a specialist in one of the clinics, like podiatry or something, and that podiatrist has to go up and examine the patient because they have a condition that is special to podiatry, right? Maybe it's a diabetic with a foot ulcer. And so then they got to call in podiatry, and podiatry goes over there. Oh yeah, you know, we got to do this, we got to do that. You want to make sure as a profi coder that the provider is getting paid for their service. That's when you use a CPT manual and you incorporate that evaluation in management. You incorporate any procedures they did and the diagnoses that they were treating and what was relevant to those encounters. So that's the thing. If they're asking for a profi coder, it's still outpatient coding, but the best example is when the patient is staying in the hospital and the provider needs to be paid for their professional service. Now, before you start hemming and hawing about evaluation and management, it is not as scary as the big chorus says that it is. There's a lot of people that run around ignorantly saying, oh, no, it's hard, it's hard, it's hard. And okay, so what have you learned about it yet? Oh, I haven't started my class yet, but I heard it's hard because everybody's saying it's hard and I'm scared. Why are you scared based on what somebody else is thinking? What may be difficult for somebody else may not be difficult for you. So stop taking on all of that energy that's going to mess you up because you don't even know about it yet. So just take the time, again, go through my videos. I have videos about evaluation and management. Y'all can let y'all's fingers do the walking and find out those videos so that way y'all can learn about the books that I recommend for evaluation and management and some of the explanations that I've given about evaluation and management. You can do that, guys. It is about your research, okay? Because that's one of the things they're probably going to ask you too, even in the interview. How do you perform your own research? Okay, you can't just say, oh, I don't know, or I use Google. You can use Google, yes, but they want to know, like, do you know how to use the guidelines, the coding manuals, the Merck manual? Can you use all of those? Those are the things y'all need to think about, okay? So again, professional fee coding is outpatient coding, all right? Now, if they're asking for an inpatient facility coder, what does this mean? Inpatient facility, that means that you are ensuring that the facility is getting paid for all of their service that they're giving to the patient. The room and board, the use of the equipment, the use of the staff, the bandages and all the other goodies, right? You're making sure that the facility gets their money for that. Now that's a little bit different. Coding for inpatient facility is a little bit different because you're not using CPT. You don't have to use evaluation and management, but you do have to use ICD-10 PCS, which you have to build those codes. And building those codes is not an easy feat because these are 7-digit codes. And even being off by one number, you mess up the whole code, okay? The whole code can be invalid just because one number is off or one letter is off. It really all depends. And with inpatient facility coding, you really have to be up on your pathophysiology game as well. And there's different rules for coding for inpatient, but you would know this by going through the guidelines and going through the books that I recommend. The ICD-10 CM and ICD-10 PCS Coding Handbook with the Answers by Nellie Leon Chisholm. Okay, that's the one I recommend. You don't have to get the 2019 book. That's the one I have in all of my videos, but it has since gone up to a ridiculous price. You used to be able to get it for $39, and now you can't get it for less than $145, last time I seen. So, yeah, I'm just saying. So, yeah, just be careful about what books you get. But you can get that particular book. You can get the current year version of that book if you like, because I'm pretty sure it's around the same price, or it's a little bit cheaper. Okay. So that's when they are asking for inpatient facility. If they're looking for an HCC coder, hierarchical condition category, right? Harry, Charlie, basically. For those that want the letters, right? HCC. So that is all diagnosis coding. It is diagnosis coding only. There is no evaluation and management. There's no procedure coding. There's no modifier application. There's no nothing. It is just diagnosis coding, right? And this is for collection, for these insurances and they're collecting data about the patients, and they want to know how much it is that they're treating and what kinds of conditions spawn off other conditions that they have and that kind of thing. They use it for basically for statistical and research purposes. The thing about HCC coding is that it should be, and a lot of people are going to disagree with me on this. You can if you want to. But here's the thing, here's what I'm saying. When you spend 6 to 8 months in HCC coding, this is a great time, because especially as a brand new coder, it's going to get you exposure to the codes, it's going to get you exposure to the electronic medical record, and that's exactly something you can put on your resume. In the meantime, in between time, you can still be applying for other jobs that are going to have you use all of your skill, ICD-10, CM, CPT, HCPCS. Is continue to apply for those positions, or the ones that are requiring you to know ICD-10, CM, and ICD-10 PCS, and of course HCPCS. Apply for those, because the reason that I say to stay in HCC coding only for a short time is because I have seen job listings. Now, if you have not seen it, that's your problem. But I'm saying that I've seen it because I've done my research. There are job listings that say if your only experience has been in HCC coding, they do not consider it as experience, because your experience is only in diagnosis coding. You don't have any CPT experience. You don't have any evaluation and management experience or modifier experience. This can hinder a coder badly. This is why I say keep it 6 to 8 months, so that way you can learn and then you can move on. Because there's some people who have written me before too, say, oh, well, I have 4 years of experience in HCC coding and I can't find a job and I don't know why. Because you've been in HCC for 4 years. You probably have not been studying CPT like you should have, right? Well, and then I hear, honestly, whenever I hear, well, honestly, I know I'm about to hear a tall tale. Yeah. So no, don't do it, guys. Don't do it. Don't do it to yourselves, because these businesses are going to look out for themselves. All right. And so, but if you want to do HCC and that's the only career you want to do, and that's it, that's, you found it, and it's good enough for you, then by all means go right ahead. But when you decide that you've had enough of that, maybe it's getting boring to you, you can't say you weren't told, because yes, you were. I'm just saying. So that's that one, HCC. What else? Of course, there's outpatient coder, inpatient coder. They'll have those listed like that as well. And we know from discussing just now, outpatient is outpatient. Outpatient in a clinic, or, inpatient, in the hospital for the hospital, and that kind of thing for the facility. So that's pretty much what you're going to encounter in a lot of those job listings. So again, ignore ICD-9, ignore the 3 to 5 years experience requirement. Make sure you arm yourself with a really good resume and that you apply anyway, okay? Apply anyway, and stop feeling sorry for yourself because you see all these places asking for experience. They did this to every one of us. Every one of us went through this same thing where we had this, where, we were looking at these job listings and they were all saying that they want experience. I went through it too. I was looking for 2 whole months trying to find my first job in medical coding before my mom said, go back to the school and see if the principal can help you get a lead on a job. And turns out he had a lead with a temp agency. Now I tell y'all all the time, and it just seems like y'all just, what do I do? What do I do? Temp agency. These temp agencies are going to have these assignments that are not these little quick assignments. They're not these little 1-day turnaround things. It's not like Manpower, This is going to be like these assignments for like 3 months and a little bit longer than that, because that's what they do for medical coders. If I call off sick, they don't call in a temp agency to come bring somebody in for the day to cover for me. No, that work is waiting for me when I get back. So, just so you guys know, that's the way that it goes. But if somebody is out for quite a while, they're going to need somebody to cover, because of course there's going to be a lot of backlog that happens. So that's when they call the temp agencies. Now, if you tell me, well, Blue, they still want experience anyway, you are looking at a staffing agency, not a temporary agency. That's a staffing agency. And I see plenty of those yahoos on LinkedIn, with their promises of, oh yeah, these big bonuses, and yeah, you must have 3 to 5 years experience. Get out of here. Really? And you see them pop up in people's DMs and stuff like that. It's just ridiculous. I just don't. Whenever a recruiter tries to do that to me, I just block them immediately. Because no. If you're doing that for these organizations, something's not right. You know what I'm saying? Oh yeah, well, we're just recruiting good people. Okay. Okay. If you put your job listing out there, you'll find people. But if they want to hire recruiters, you go right ahead. But no, you're not gonna sit here and get me involved in that stuff. I don't think so. So yeah, that's what I mean. Look in your area for temporary agencies. Google it. Temporary agencies for medical professionals, and then you will find those. And maybe you have to take on an alternative position, like the ones that I've been saying before, which was medical billing, prior authorizations, HCC coding, or something else. Like I said, there's the medical claim reviewer. Medical claim reviewer, you're not required to be a coder. You're examining the claims on behalf of the insurance company, right? And so the insurance company is going to tell you, okay, if they have any of these things, then this is what we deny. And then it's up to you to look at it. Well, guess what? You're rolling up in there with a certified medical coder credential. Come on. Like, they're not going to give you a second look? Of course they will. And guess what? That's transferable skill that you could put on your resume, and you can still continue to apply for coding positions. And then guess what? You may find yourself with a coding position because you went and took something else just temporarily, just to get you going and get you exposure, than the opposite. Because some people say, well, I should want to volunteer. I should volunteer to do this so I can get experience. Nope. And I'm going to do that on another video. That you shouldn't be giving away your time because you have technical skill. And I'll get into that in another video. But yes, guys, look at these job listings. Apply for these positions. Arm yourself with a really good resume. And Google things that you don't know. If you didn't know professional fee and you just put pro fee, you'll find a lot of information about that in Google. All right. So that's just something else that can help you. So with that said, I'm going to go ahead and wrap this one up. Best of luck to you guys, and get out there and just start applying. All right. And make every application intentional. Make sure that you are identifying on your resume and your cover letter the position that you are applying for. And please do not tell me that, oh no, I thought we didn't have to do cover letter. Cover letter is not a regurgitation of your resume, but your cover letter is that humanistic draw for the company about yourself. That's when you can talk about all your soft skills, all the team player, organized, and stuff like that. That's not for the resume. That's for the cover letter when you're having a conversation, and it's that hook to bring the person to give you a call and say, hey, let's set up an interview. I'm just saying. So with that said, now I'm going to wrap this one up. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.